This chapter is going to look at administering medications in the athletic training setting. So we're going to be basically discussing in this chapter is looking at ways that medications are to be stored, given out to patients, and some of the legal issues kind of surrounding some of that, and based upon what type of work setting you're in, kind of what you need to have in place to make sure that you're abiding by all appropriate laws. So in looking at athletic training clinics or just any type of general sports medicine facilities where you're employed as an athletic trainer, we need to look at what that includes. So obviously we have a lot of what we would still consider more of our traditional athletic training settings in a high school, collegiate athletic training room, clinic, so on and so forth. You have to also understand that that sort of site also includes, kind of some of the ancillary areas. So for instance, event sites, team bus hotels, hotel rooms, that's sort of almost like an extension, because you could be potentially delivering, for instance, athletic training services in a hotel room if you're traveling with a team. So that's something to keep in mind. And obviously we do have emerging sites. So again, industrial, military, police, fire, and various sorts of entertainment venues, higher athletic trainers, particularly, entertainment venues where performers perform obviously very physically physically taxing skills. So again, being mindful of, again, local, state, federal issues regarding delivery of really any type of healthcare services are important. Obviously, within this discussion, we're very focused on we're very focused on medications, given the focus on pharmacology. Be mindful that a DEA registration. So if you are going to house controlled substances, you need to have a valid DEA registration in order to do that, okay? And again, depending upon how your facility is constructed, you need to make sure that, you have one for each of those facilities. So wherever these are going to be housed, you need to make sure that they're doing that. So that's going to be one important thing to keep in mind. And again, you'll be working closely with your team physician in doing that, so hopefully that would be in place anyway. Now, just kind of regarding medications in general, obviously, again, board of certification policies, procedures of managing meds are essential, and this will pretty much keep you up with a lot of those legal issues that we discussed. So again, make sure you establish a general policy. So again, you should have a policy procedures manual in place in general. So again, kind of expanding just beyond the topic of pharmacology, that your facility should have a policies and procedures. So policies are kind of what the expectations are of the people that work there. Procedures are sort of how those policies are going to be carried out, or basically the instructions. So again, we want to have a straightforward policy on medications, and again, your team physician could be could kind of work with that. Again, the more straightforward they are, the less there is a chance of misunderstandings or somebody not kind of abiding by those. So again, make sure you're familiar with state and local laws, and that you work in conjunction with your team physician. So again, all ATs. So if you're supervising other athletic trainers, again, making sure it's all communicated. And again, all policies, procedures should always be reviewed annually. So this should be something that some time should be taken out of the course of the year to kind of review these policies and procedures, make sure administrators understand them, so that again, in the case that there would be an issue down the road, everyone's kind of on the same page with how these issues need to be handled. So in looking at guidelines for administering medications, and again, we do administration of medications in the athletic training setting. The standards for that were established in 1992. And again, what the idea there was looking at like compliance and specific documentation. However, if you've read the chapter prior to looking at this, you know that there were some issues as far as athletic training compliance. Not everybody was as familiar with these guidelines as they should have been. So it's really important to make sure that, particularly now with athletic training practice, to make sure. So there was some issues with, as far as like understanding compliance and documentation. For instance, a lot of athletic trainers were having students give out medications, which again, as we all know, you can't do. So again, making sure that that there's compliance with all of that. So again, looking at current CATI standards, again, there's really important points as far as educating patients and administration per the physician orders. Okay, so for instance, educating patients regarding appropriate pharmacological agents and for the management of their condition. So obviously, again, as part of CATI standards, athletic trainers need to be able to educate patients on medications that they've already been prescribed, talk to them about indications, contraindications, dosing, and any type of adverse reactions. And again, we could also, again, administer medications or other therapeutic agents by order of your team physician. Okay, so again, as the team physician permits it within standing orders, we are able to administer medications based on those standards. Again, I've already kind of talked about there's been concerns with AT compliance in the past. Again, things such as, number one, not documenting medications given out to patients, having students give medications to patients. Again, all of those things need to go through the proper channels as you're doing that. So again, lack of proper storage, that's another thing. So again, we're going to be talking about all of this. Again, AT students should never be distributing even over-the-counter drugs to patients. And again, inadequate tracking and documentation. So there needs to be, documentation, tracking of all of the different types of meds, and we're going to talk about how to do that. Now again, treating patients who are minors, this kind of takes on a whole kind of other level. So if you're employed at a high school, is obviously where you'll kind of encounter this the most, and because obviously really all, most of, if not all of your patients will be under 18 years of age. So a couple things with that. The Council on School Health recommends district-wide policies. So within a general district, there should be general guidelines on this, and typically this will be handled by the school district. And just as a general, no meds for minor patients without parent written consent. So that's a pretty simple thing that we could look at. And again, this could also be, again, district-wide, district to district, this could be different. Some districts may just not want any medications given out in the athletic training setting. And if that's what they want, then that's how they'll kind of handle it. But in general, no meds for minor patients without parent written consent. And that'll be a pretty standard thing for the most part. If you are in a high school setting and you are going to administer over-the-counter meds, you will need parental consent in order to do that. So going through administrative principles, again, this kind of looks at some ways that you'll be kind of conducting your practice in your athletic training facility. So again, we already kind of talked about the idea between policies and procedure, and you should have a general policy and procedure manual anyway. And again, basically this is kind of like your framework for how just things in general be managed, but you're going to have kind of a section of this dedicated to medications and protocols. So we're going to, you'll establish protocols for administering, dispensing, managing your inventory, keeping records. And again, you want to make sure that all of these policies are reviewed annually. Okay, so very important. And again, this will kind of act as a guide as to how the medications will be handled within your facility. And again, a lot of the concepts behind this, obviously the big thing to manage if you're going to manage prescription medications, but there should also be, again, you also want to make sure to outline over-the-counter drugs and how those are going to be managed as well. Make sure to understand applicable federal, state, and local laws. We've kind of talked about this constantly throughout in the first chapter. federal laws will supersede state and local laws relative to managing medications. So again, that's one thing where things can maybe get a little confusing, but that's something to note. So again, if there's federal guidelines, that's what you're going to have to use regardless of the state and local statutes. So again, in order to store or administer controlled substances, you need to make sure that that's led by the team physician and the individual that, and they should be the individual on record who registers the athletic training facility with the DEA. So if you are going to have controlled substances, you need to have that DEA registration on site. And DEA's permits are site specific and they can't be transferred. So again, whatever facility or whatever area you're going to have to have a DEA permit for that specific facility, and that'll be also then under obviously the name of your team physician. So there should also be a chain of command with the supervising physician. So there should be a hierarchy of responsible individuals within this. So again, the duties and responsibilities such as ordering drugs, inventory tracking should all be delineated. The big part of this is that AT students are never in the chain of command. Okay, so again, it should be noted who's involved in managing the medications, obviously starting with the team physician at the top of this, and then whoever on staff is going to be seen doing this. And it may not be a specific person, but again, delineate that. The big important thing is that athletic training students are never kind of in that chain of command or in sort of that area of managing medications. Tracking medication through documentation, so you want to make sure that you're keeping proper records. Records have to be stored in accordance with state and federal laws for 3 years. So not only do you keep records, those records have to be kept for at least 3 years. So you want to make sure that there is a very organized and kind of functional record management system for this. Very important for in the case that, again, just legally if something were to come up, but you also got to make sure that you're keeping those. And it has to make sure the record should cover a couple different things. So what I want you to do is you go through your reading, make note of what needs to be tracked. So it's not just the person's name and that they were given a medication. There are certain things that need to be included in that log. Proper disposal of expired medications. So expired or damaged prescription and OTC medications, they have to be rotated out of stock. You never want to dispense or give out any type of expired medications. A reverse distributor should be used to dispose of any expired inventory. So you want to make sure that you're doing that so you don't just throw them in the trash or you don't flush them down the toilet. You want to make sure you use a reverse distributor. Any returned medication should also be added to a destruction container immediately upon return. So we need to make sure that proper disposal of expired medications happens. Again, we're not just throwing things in the garbage, flushing them down the toilet. They're getting disposed of properly. You want to make sure that labels are correct. Again, if there's a prescription medication, they should be labeled exclusively for the patient they were intended for, and they should never be shared. So if there is an issue with a prescription med, they should be labeled appropriately, and making sure that they're never shared between teammates. Proper storage, so all medication should be stored in a locked cabinet. Controlled substances have to have a higher level of security. They should be in areas that are only accessed by the team physician. So typically there is usually an office somewhere. They need to be stored in there. They should not be in cabinets in general traffic areas. So if you're going to have controlled substances, those need to be kept somewhere that the level of scrutiny with the security needs to be a little bit higher. So in other words, you may see like in some facilities where over-the-counter medications, they're still stored in a locked, they should always, all medications should be behind lock and key. You might see like, for instance, over-the-counter medications might be in a general traffic area but still locked. Controlled substances need an extra level of security with that, so you need to make sure that you're doing that appropriately. Um, so again, ideally, those would only be in an area where the team physician can access them. So again, in like an office or some other non-general traffic area would be important, would be where you would store those. And again, have a policy for sample medications. So again, the sample medications are when you again get those kind of pre-packaged um, medications where in individual packets where and they'll many times be even in for prescriptions. You need to make sure you have proper documentation and make sure and understand that the samples have to be owned by the licensed physician. Okay, so again, it's really important that there's a paper trail with this. And that they're kind of overseen as far as the distribution by the team physician. So looking at medication administration in the athletic training facility, so there was a consensus statement, and this is a very good resource to utilize. Um, the consensus statement on managing prescription and non-prescription medications in the athletic training facilities. So this was basically a statement issued by the NATA back in 2009, kind of basically outlining all of the different things regarding medication in an athletic training facility. Again, if you follow these guidelines, you're going to be safe as far as like worrying about legal issues. So again, kind of outline your personnel. Again, review all the roles involved, and we've kind of discussed this. So your athletic training, your athletic trainers, your physicians, pharmacists, any appropriate administrators, and who is all involved in that. So it's important to kind of outline those things. Packaging of medications. So again, if in the case of more than one dose being administered, so the concept of administering meds is administering a single dose packet that is to be taken right away. If more than one dose is being administered to a patient, the dose should be dispensed in a single secured package provided by a pharmacy. So again, you can't just take a bunch of, for instance, over-the-counter anti-inflammatories, put them in a bag, and give them to somebody. Okay, there needs to be appropriate packaging of that medication. So again, from an athletic trainer's perspective, and typically in your standing orders, you're going to be permitted to give a single packet to that person to be basically consumed at that time. If there's going to be an actual dispensing of medications, there needs to be more scrutiny with that. Okay. Labeling, again, all medications need to be kept in original packaging and labeled with specific patient information. Okay, so you have to make sure that all medications stay in their packaging. If by chance there is going to be a prescription that the patient is going through that you're getting through the pharmacy, again, it needs to be labeled for the patient. Distribution, again, so physicians are the only personnel allowed to distribute prescription medications. Only sports medicine personnel can distribute over-the-counter medications. So athletic training students must never furnish or give out any type of medications. So again, that's a pretty simple concept to remember. Again, documentation. Again, you want to make sure there's records of all medications that are administered, dispensed through your facility. Again, if there's going to be some type of prescription meds given out, make sure everything is documented regarding that. Inventory control, and this is something that you need to keep in mind. This kind of goes towards keeping records as well. So again, periodic reconciliation. So again, this should be something that would be spelled out in the policies and procedures. You're going to go and look at and make sure that the inventory that you have in-house matches what has been given out, okay? And that would be for both prescription, over-the-counter, or controlled substances if they're getting housed in your facility. Disposal of medication. So again, you have to have destruction. You'll typically have what's called a destruction container, and again, that would be in accordance with state regulations. with a designated pharmacy or a reverse distributor. So you want to make sure, again, if you do have to dispose of medications, that they're disposed of properly. Again, you could find a local pharmacy as well. They can act as a resource for that as well. And then emergency medications. So again, you want to look at what emergency medications are going to be available for individual needs. And again, that'll be something that can be worked out with your team physician. Again, the team physician can oversee that and determine what specific emergency medications would be, available. Like something, for instance, like an EpiPen. That would be an example of an emergency medication that would be kept on hand. Again, how that would be handled could be worked out with the team physician. So looking at different types of drug orders. So again, the athletic training clinic has to have an exact guideline for all physician orders. So again, this should be something that should be written out. So, before we look at different types of orders, again, just one thing to note, that in emergencies, a prescriber can give the AT a verbal order for the medication. And if the prescriber is not in the clinic or in the athletic training facility, they can give it over the phone. Okay, so again, but this is something that should still be kind of spelled out in policies and procedures. Again, this policy should be communicated with the staff, and the policy should determine who is able to take those particular drug orders. Okay, so, and if you're going to take a verbal order in the case of an emergency, you need to make sure that it's documented. Okay. And the documentation has to include certain things. For instance, should include the name of both the clinician and the prescriber. And again, you should also read the order back to the prescriber so that they're aware as to what you're documenting. Okay. And typically within 24 hours, the prescriber should co-sign that verbal order in order for it to be valid. Okay. Now, the other types of orders that we're going to kind of look at. So, as far as these things, a standing order, again, a standing order looks at a drug is to be administered until discontinued or for a certain number of doses. Okay, beyond this, a renewal order has to be written by the physician before the drug may be continued. Okay, so that's a standing order. A stat order is a one-time order to be given immediately. So this is something that would be this is basically needs to be administered right away. A single order is a one-time order to be given at a specific time. So that falls underneath that type of order. And a PRN order is basically given as based on the patient's needs. Okay, so those are kind of some of the general orders. Some facilities do have what's called a now order. Where a healthcare provider has 1.5 hours to give a medication. This is different from a stat order, so a stat order has to be basically given within minutes. A now order, as is described, and it's talked about in the chapter, you basically have like an hour and a half to give the medication. Okay. Again, with all of these orders, the clinic's policy has to clearly define what's in the order and how they're carried out and who may carry them out. And also, as you can see, we have PRN in here. Very important that you're familiar with common abbreviations, which we're gonna go through abbreviations in this class on pharmacology so that you avoid any type of errors with medications. Drug packaging, so again, historically there's been some kind of issues with these in a lot of particularly our traditional settings. So historically with packaging of meds, and this is even with prescription meds, is that we've been basically, you have individuals who've taken pills or tablets from like a stock bottle that's actually labeled with a specific med, and then just kind of transferring them to a general bottle or a small envelope. This is something that can't be done. So again, the Department of Health and Human Services defines this as repackaging, and it doesn't meet the FDA standards for basically distributing a medication. So when you have a finished drug in a container from a manufacturer, you can't take that out, put it in your kind of own package, and then redistribute it again. And part of the issue with that is, the Food and Drug Administration is concerned about basically like the medication safety, efficacy, stability of the medication. So again, it's a safety issue for the patient. So we have to make sure that doesn't happen. Okay. So the contemporary, sort of blister pack for a specific medication, is essentially how the medication should be given to the patient. So again, this particular type of packaging is going to have a specific number of doses. It's going to be packaged by the manufacturer, dispensed by the pharmacy, and then needs to be basically administered to the patient in that particular unaltered state. So again, for the individual drugs, again, put together by the manufacturer, the approved pharmacy, there's going to be the label affixed to it. And again, that's also going to be important for just documentation and copying to the patient's file. So again, and you'll see if you look at the there's a picture of a label in your book. I'm sure we've all seen a prescription label. So that is basically how drugs should be packaged. I would say the same goes as well. Like, for instance, if you are going to have over-the-counter meds that you are going to administer as a single dose, you need to have the individual small packages. So in other words, you can't just buy a large bottle of, an non-steroidal anti-inflammatory and then take 2 out and give them to a patient. You need to buy the individual packages to be able to give out. And again, that's for, it's for the safety of the patient and for the stability of the individual medication. So it's important that all of that is kept in place. And again, particularly as it relates to documentation, again, from the standpoint of a prescription medication, having it in the actual pharmacy labeled bottle will be important for documentation as well. So regarding filling prescriptions, again, the appropriate process of furnishing prescription medications in an athletic training setting is no different than for any other patient consulting with a prescriber. So there's core components of information required on a prescription label. So if you look at the figure in your book, they kind of go over what would be on that prescription, on that the requirements of the prescription. It goes through all the information needed. So take a look at that. That's going to be important to know. Again, we're also moving away from Latin abbreviations. So all the abbreviations that you will need to know, if you look at Table 2.1, goes over all of the abbreviations, so make sure to kind of look at that as well. It's going to be important for you to know those abbreviations in practice so that you kind of know what they mean. Okay, so again, 2 things to look at from the textbook. Make sure you kind of look at, again, what's required on a prescription label, and then what is also as far as the abbreviations. So here's an example. This is actually right out of your textbook. So this kind of shows you what needs to be included on the actual prescription label. So you could see all the different important things noted here. So the pharmacy name and address, the number used by the drugstore to identify the drug for refills, the person who gets the drug, instructions on how the drug is to be taken, the name and strength of the drug, if there are any refills. So obviously, if there are no refills, if for some reason the individual needs a drug for a longer period of time, that's going to need to be done by the prescriber. The drugstore phone number, the doctor's name, the fill date, and a use before date. So you should not use for obviously efficacy of the drug. It should not be used beyond that. So that's all important information. Again, really important that you know those abbreviations as well. So make sure to pay attention to that in your textbook. Again, that's the table 2.1 for the different abbreviations. So preventing medication errors. So again, we want to make sure that we're preventing errors, and basically a lot of errors are preventable just through, again, just simple due diligence. But errors can be lethal to patients, particularly regarding medications. So you want to make sure that we try to avoid these by all means possible. And again, for the most part, if you're being responsible, carrying things out, and being thorough, these could be minimized and or completely eliminated for that matter. So common factors associated with medication errors. So these are things to be mindful of. Again, anytime you have medications with similar names or packaging, so very important to make sure that the patient is educated on their medications. Um, Medications that are uncommon or not frequently prescribed. So it's make sure that, again, you educate yourself. If you're unfamiliar with a medication that one of your patients has taken, which could be a thing, because regardless how much you practice, there's always new medications. Familiarize yourself with it ASAP. Make sure you're aware of it. Patient allergies is something to note as well. So make sure that should be something in their medical record. And then medication testing to ensure therapeutic levels are met. So we want to make sure that, so these are common factors associated with medication errors. And again, through, appropriate management, we could avoid a lot of these. Some concerns in the prescription process. So these are some things that could kind of come about. And errors that, again, these could all be prevented. So again, sloppy handwriting or reliance on old Latin abbreviations. So again, there's been a move away from the Latin abbreviations. Make sure that everyone's familiar with the appropriate abbreviations. Improper spelling of patient's name. Lack of electronic digital prescribing capacity. So again, a lot of things have moved to electronic medical records. You want to make sure that everything is updated with that. And particularly in the United States, there could be a concern with understanding English. So you want to make sure that, again, make sure the patient clearly understands what's supposed to take place with the medication. So making sure that that's kind of covered. They're well aware of what they're taking. That all of that, any type of error can be avoided. So these are what we call the rights of medication administration. And again, like I said, for the most part, as long as you're being careful and diligent with things, for the most part, you should avoid a lot of problems. Okay. Again, nothing is ever 100%, but certainly if you do these things, it could be managed very well. So these are, again, we call these the rights of medication administration. This is also in your book. So, patient, is it the right patient? Drug, is it the right drug? Is it the right dose, right route, right timing, and right documentation? So again, all of this can certainly be a very simple thing to follow, making sure that all of this, is in place. Should avoid a lot of those errors and any type of unnecessary severe issue that could kind of come from that. So make sure that all of these things are in place for the individual patient, and there really should be very little, if any, problems associated with it. Now, again, if all this could be in place, if a patient has never taken a drug before, they may still have, for instance, an adverse reaction to it. Again, that would be something that within patient education they're aware of, that if they have an adverse reaction, who to contact, right away. So in other words, what's something that they should be on the lookout for, that if it happens, for instance, they may have to immediately go to a medical facility. And again, that will kind of come in on the education side of things, which you want to make sure that the patient is clear with. Again, particularly if it's a new medication for that individual patient. So just in summary, medicine certainly have a role in restoring patient well-being. Make sure that you're following guidelines. And again, you protect yourself, you protect your patients when you follow a lot of these things. Make sure, again, proper documentation. Documentation is a really important thing. And again, having policies and procedures in place that abide, be familiar with your federal, state, and local laws when you're doing that. Providers and clinicians give clear instructions. And this is an area where, you as an athletic trainer will definitely play a large role. You're going to be an educator many times regarding this. So make sure to give them clear instructions as to how the medication should be taken, when the medication should be taken. If they have an adverse reaction, how they should handle it. Should all be given to the patient and documented. And again, conceptually, it's critical to respect patients by following the rights of medication administration. So just what we went over, it's very basic, but for the most part, it's going to cover the steps involved in making sure that the patient is safe and making sure that the medications are handled appropriately. And then these are your objectives that you want to make sure that you look over and are familiar with for testing purposes from this particular chapter.